Hello and welcome. In this tutorial, we will be discussing how to plan virtual surgery using the surgery module in On3D software. We will set up the surgical plan for a patient after completing the virtual osteotomy procedure. Click on Surgical Planning in the Work Selection panel. This is the data of the patient whose osteotomy procedure has been completed. In the Maxillary Virtual Surgery panel, simply clicking the two auto-correction buttons in sequence will complete the maxillary surgery. After completing the maxillary surgery, click Pre-Mandible Virtual Surgery to switch pre-mandible virtual surgery to post-mandible virtual surgery, and the pre-planned mandibular surgery will appear. If the post-surgical final occlusal relationship is included in the dentition scan data, the mandible will move to the pre-planned post-surgical position. This completes the virtual orthognathic surgery with just a few clicks, making the procedure incredibly simple. Here is a brief explanation of the basis of the autocorrection in the maxillary virtual surgery. The treatment planning process is based on repositioning the selected landmarks into ideal position and changing the selected measurement values to their normal values. For the normal values, the X values of all landmarks in the frontal view are set to 0. The Y value of the A point, which represents the anterior-posterior position of the maxilla, is set to be -2 mm. The inclination of the upper central incisors, connecting the crown tip and root tip points of the maxillary incisor, is set to 110 degrees relative to the FH plane. Vertically, the position of the upper incisor crown tip should be 2 mm below the stomayon superius with relaxed upper lip. Autocorrection involves automatically repositioning of the maxilla so that the selected landmark's position and measurement values become normalized. If the result of maxilla virtual surgery by autocorrection is not satisfactory, you can adjust the virtual maxillary surgery. Before explaining that, let me first go over the virtual surgery steps. On3D is designed to proceed maxillary virtual surgery step by step. In virtual surgery, the movement of the maxilla consists of two types of movement: translation and rotation. If you hover your mouse over the text, explanations for each step will appear. Next, I will explain the movement of the maxilla step by step. Upper 1 MP correction is the bodily movement of entire maxilla along the x-axis. Next, upper 6 MP correction is rotation of the upper 6 MP around the upper 1 MP as its rotation center. This is the yawing correction of maxilla. Looking at the axial view, the maxilla first moves bodily through upper 1 MP correction, and then yawing correction is applied with upper 6 MP correction. Next, canting correction is a coupled rotation of right upper 6 CP and left upper 6 CP to equalize the Z values of the both landmarks when viewed from the frontal plane. Total elongation impaction is a bodily movement of the maxilla along the Z-axis. Posterior impaction elongation is the rotation of upper 6 MP around upper 1 MP as its rotation center. In the sagittal view, upper 6 MP is rotated around the upper 1 MP. Finally, the advancement or setback of the maxilla is a bodily translation along the y-axis. Once the maxillary virtual surgery is finished, the mandibular virtual surgery can be done based on the pre-planned final occlusal relationship, which is saved in the dentition scan file. Based on this understanding, let us review the virtual surgery for this patient step by step and adjust wherever necessary. It will be helpful to refer to the values on the right side of the screen while adjusting. The topmost group on the right shows the pre-surgical landmark values, the bottom group displays the post-surgical landmark values, and the middle section shows the differences between the post-surgical and pre-surgical values, that is, the surgical movement. In On3D software, the amount of surgical movement is determined based on the movement of the teeth, which is clearly visible during surgery. If you are interested in the changes of non-dental landmarks, you can refer to the values of other landmarks on the right. To review all the pre- and post-surgical landmarks and measurement values, and their changes, click on Generate Surgery Plan Report in the Data Export panel on the left. Download the Excel file from the Surgery Plan Report to view all the pre- and post-surgical values and their respective changes. The anterior midline is set by adjusting the x value of upper 1 MP to 0. As the x value of upper 1 MP is set to 0, you will see that the key landmarks in the maxilla move bodily by the same amount. The posterior midline correction is a yawing correction. After determining the amount of maxillary surgery, adjustments will be made to the mandible, focusing on the symmetry of the inferior border of the mandible. Now let us try canting correction. This will align the z-values of the right upper 6 cp and left upper 6 cp to be equal by doing the rotation of maxilla along the axis of upper 1 MP and upper 6 MP line. When determining the vertical surgical movement for the maxilla, it is ideal to set the incisor stomion value to 2 mm. However, in this patient's case, doing so would result in a lack of bone contact at the maxillary osteotomy line. Therefore, to ensure postoperative stability, we will adjust the total elongation amount. The posterior impaction has been automatically adjusted to ensure that the inclination of upper incisal is to be 110 degrees, and the anterior-posterior movement of the maxilla has been set to the position where the y value of the A point to be -2. The AP position of the maxilla is acceptable, but due to the patient's prominent nose, we have decided not to proceed any maxillary setback. Click on Pre-Mandible Virtual Surgery to review the post-surgical position of the mandible. Since the inferior border of the mandible is somewhat steep, we will reduce the amount of posterior impaction. To reduce the bilateral vertical discrepancy of the inferior border of the mandible, we will apply overcorrection to the canting correction. We will adjust the amount of yawing correction to improve symmetry in the inferior border of the mandible. Up to this point, we have explained a virtual surgery workflow in which the maxillary surgery is planned by direct input of values, while the mandibular surgery adopts a predefined final bite. From here on, instead of adopting the preset final bite, we will demonstrate how to perform mandibular virtual surgery by direct input of the values of surgical correction, using the same approach applied to maxillary virtual surgery. If you look at the Mandible Virtual Surgery panel, you will see that Use Pre-Registered Bite is selected by default. When this option is unchecked, you can plan the mandibular virtual surgery by entering values manually, just as you would for the virtual maxillary surgery. As with maxillary surgery, clicking two buttons of Auto-Correction will complete the mandibular surgical plan. First, activate the previously planned maxillary surgery, Then click Pre-Mandible Virtual Surgery to execute the mandibular surgery. If you check the postoperative values in the right side vertical column, you will see that the X values of lower 1 MP and lower 6 MP change to 0, and that the Z values of the left and right lower 6 CP become identical. However, unlike maxillary surgery, mandibular virtual surgery has to be modified to achieve best possible interdigitation between the maxillary and mandibular dentition. In this case, you can see that the collision between right posterior occlusion. For this reason, mandibular virtual surgery requires an additional procedure. By clicking Vertical Adjustment, the position of mandible is changed until the collision is disappeared, and first point of tooth contact between upper and lower right posterior teeth is reached. After clicking the vertical adjustment, only teeth number 16 and number 47 are in contact, while all other teeth remain untouched. It is expected that postoperative occlusal stability would be insufficient, so we will proceed with additional manual adjustments. In the axial view, you can see that the pogonion is slightly deviated to the right. For a clear assessment, click Landmark in the Display option panel. Preoperative landmarks are shown as red points, and postoperative landmarks as blue points, allowing you to visually assess the changes without referring to the numerical values. We will slightly adjust the posterior midline correction value toward the left. After clicking Vertical Adjustment, again, you can see that the occlusion has closed more than before. However, most teeth, except for the right molars, are still not in contact. Since the inferior border of the mandible remains misaligned, we will adjust the canting correction value so that the left side moves upward. After applying vertical adjustment one more time, both left and right molars now contact evenly. Resulting in a more stable occlusion. You can also see that the X value of the pogonion is now close to 0, indicating improved symmetry. The alignment of the mandibular inferior border has also improved significantly. This concludes the explanation of how to plan mandibular surgery by direct input of surgical values. Since we are going to use pre-registered final bite, we will reactivate Use pre-registered bite. Once the orthognathic surgical plan is finalized, we will adjust the position of proximal segment of the mandible. Click on Proximal Segment Adaptation. We will rotate the proximal segment around the y-axis of the condyle to bring it in contact with the distal segment. We will rotate the right proximal segment 4 mm to the right around the y-axis, and the left proximal segment 8 mm to the left around the y-axis. You can also consider rotations of proximal segments along other axes in the virtual surgery simulation. Once the position of the proximal segment is confirmed, click Update and then Done. For this patient, since the post-surgical position of the chin is acceptable, we will not proceed with chin advancement. However, since the ratio of total facial height to lower facial height is shorter than the normal 55 to 56%, we will perform genioplasty to elongate the chin. To optimize bony contact during genioplasty, we will perform a clockwise rotation along the sagittal plane. Let's review the virtual surgery plan we have established so far. You can either go step by step and click through each stage to check the progress, or check the overall position of the maxillary surgery. After completing the maxillary surgery, proceed with the mandibular surgery to confirm the post-surgical position of the mandible. Next, check the movement of the post-proximal segment. Finally, perform the genioplasty. You can check the amount of surgical movement by looking at the values on the right. For example, the pogonion has been advanced by a total of 11.08 millimeters. Once the final surgical plan is confirmed, click Generate Surgery Plan Report in the Data Export panel to generate the PowerPoint file of virtual surgery. You can export the data in two formats, PPT and Excel. The PPT is a summarized report that automatically captures changes in key values and the 3D images from the virtual surgery. As mentioned earlier, the Excel file contains comprehensive data that shows the changes in all landmarks and measurement values numerically. Click PPT. Surgery Plan. Select the destination folder where you want to save the file and save it. Let's open the generated file. The first slide summarizes the virtual surgery plan along with the pre- and post-surgical values. The remaining slides capture images of the pre-surgery, maxillary surgery, mandibular surgery, proximal segment movement, and genioplasty, covering all three plane views: coronal view, right and left, sagittal views, maxillary and mandibular axial views. This allows you to qualitatively check the surgical process from every angle. The final slide in the surgery plan provides a one-page summary for printing and use in the operating room. Now, let me introduce a tool that will help to place maxilla in correct vertical position during surgery. The vertical reference tool replicates the vertical reference used in the operating room. In the vertical reference panel, click Place Reference Implant to position mini-screw as the reference point, just like you would in an actual surgery. Once the position is set, click Done. This will add a mini-screw to the volume. Click Add Measurement to measure the distance between the reference point and the placed mini-screw, just like using with a caliper. You can add more reference points to measure as needed before you click Done. To delete a measurement, hover your mouse over the number, and when it turns yellow, right-click and select Delete Measurement from the pop-up menu. After adding all the points of reference, click Done. You can also easily toggle the visibility of the measurements by clicking Visibility On and Off. By using this function, you can measure the position of specific points before the virtual surgery and then remeasure the same points after the surgery to compare the differences. This can be very helpful in the actual operating room. That concludes our tutorial on creating a surgical plan using the surgery module. Thank you.